1. Which of the following is a primary legal requirement when creating a patient education curriculum in a clinical setting? A. Following state residency requirements. B. Adhering to HIPAA confidentiality standards. C. Including personal testimonials. D. Using copyrighted images from the Internet. 2. The principle of do no harm is aligned with which ethical foundation in medical assisting? A. Veracity. B. Fidelity. C. Non-maleficence. D. Justice. 3. An effective adult learning strategy in clinical instruction includes A. Mandatory memorization of content. B. Passive lectures without interaction. C. Linking content to real-life scenarios. D. Repetition without context. 4. When mentoring a new medical assistant, the most ethical action is to A. Assign the assistant tasks outside their certification. B. Allow them to shadow without guidance. C. Provide clear feedback in supervised task execution. D. Let them work independently on first day. 5. A breach in patient confidentiality may occur if A. A staff member shares patient data with a billing company under a HIPAA agreement. B. A nurse discusses a patient's case in a crowded hallway. C. A physician accesses patient records for treatment purposes. D. A patient gives written consent to disclose information. 6. Which method best evaluates the effectiveness of a medical assisting training program? A. Instructor's popularity. B. Testimonial letters. C. Pre- and post-assessment scores. D. Use of colorful materials. 7. According to adult learning theory, which approach is least effective? A. Group collaboration on case studies. B. Relating new information to past experiences. C. Rote memorization of terminology. D. Using self-directed assignments. 8. The main goal of a professional code of ethics in healthcare is to A. Increase profits. B. Encourage patient loyalty. C. Guide behavior and decision-making. D. Avoid malpractice lawsuits. 9. Which of the following is considered a HIPAA violation? A. Discussing a patient's case in a private, authorized team meeting. B. Sending patient records through an encrypted platform. C. Leaving patient charts unattended in a public area. D. Accessing a patient's record for care purposes. 10. A medical assistant is asked to teach a new procedure but is not trained in it. What is the best ethical course of action? A. Decline and report to a supervisor. B. Attempt to teach based on similar experience. C. Review the manual briefly and proceed. D. Ask a peer to cover the topic without notifying anyone. 11. In instructional design for medical assistants, formative evaluations are used to A. Provide final grades. B. Gather feedback during instruction. C. Issue certifications. D. Replace summative tests. 12. Which federal regulation governs the confidentiality of substance use disorder patient records? A. HIPAA Privacy Rule. B. Affordable Care Act. C. 42 CFR Part 2. D. High-Tech Act. 13. The role of reflective practice in clinical mentoring is to A. Encourage passive learning. B. Reduce instructor responsibilities. C. Help men self-assess and improve. D. Replace hands-on training. 14. Which is a key characteristic of andragogy in adult learners? A. Dependence on the instructor. B. Preference for rigid testing methods. C. Desire for autonomous, goal-oriented learning. D. Need for childlike repetition. 15. Failure to obtain informed consent can result in a charge of A. Battery. B. Negligence. C. Defamation. D. Abandonment. 16. Which activity best demonstrates regulatory compliance in clinical documentation? A. Omitting details to save time. B. Documenting before performing procedures. C. Falsifying signatures for routine checkups. D. Accurate, timely charting with proper signatures. 17. Which feedback technique is most effective in skill-based clinical training? A. Delayed feedback during end-of-year review. B. Negative reinforcement to ensure discipline. C. Immediate, constructive, specific feedback. D. Vague praise after every procedure. 18. An example of unethical conduct by a medical assistant is A. Clarifying patient questions about medication. B. Calling patients using confidential information without consent. C. Following scope of practice guidelines. D. Documenting procedures properly. 19. The concept of scope of practice is defined by A. Federal government exclusively. B. State laws and regulatory bodies. C. Institutional policies alone. D. The preferences of the supervising physician. 20. A key communication strategy for adult learners is A. Overloading slides with text. B. Encouraging passive note-taking. C. Using interactive discussions and case scenarios. D. Repeating content without asking for feedback. 21. Which of the following best promotes patient autonomy? A. Requiring family members to make decisions. B. Mandating treatment plans without explanation. C. Providing all relevant options and allowing choice. D. Limiting patient input to prevent confusion. 22. The best way to ensure curriculum relevance in adult medical education is to A. Base lessons on textbook definitions. B. Integrate common workplace tasks. C. Minimize real-world scenarios. D. Standardize testing only. 23. Which component is essential for mentoring effectiveness in a medical office? A. Critical evaluation without discussion. B. Access to up-to-date clinical resources. C. Punitive responses to mistakes. D. Fixed timelines with no flexibility. 24. Which act gives patients the right to access and amend their medical records? A. Emergency Medical Treatment and Labor Act. B. HIPAA. C. Affordable Care Act. D. Food and Drug Administration Modernization Act. 25. When evaluating clinical competency, the most objective method is A. Verbal assessment. B. Written survey. C. Skills checklist with performance metrics. D. Instructor's personal opinion. 26. Which law ensures that patients are informed of their rights to make decisions about their medical care? A. Affordable Care Act. B. Patient Self-Determination Act. C. Americans with Disabilities Act. D. False Claims Act. 27. Which of the following most effectively ensures compliance in medication administration documentation? A. Completing records at the end of the shift. B. Charting after lunch break. C. Real-time documentation post-procedure. D. Documenting from memory later. 28. In a mentoring relationship, the mentee should primarily be responsible for A. Evaluating the mentor's performance. B. Leading department training. C. Driving their learning goals and asking questions. D. Avoiding all errors independently. 29. How does FERPA differ from HIPAA in healthcare settings? A. FERPA applies to employee education. B. HIPAA covers only electronic files. C. FERPA protects academic records. D. HIPAA allows unrestricted data sharing. 30. Which of the following is a core element in developing a curriculum for adult learners? A. Rigid, unchanging content. B. Pre-recorded lectures without interaction. C. Flexibility for self-direction and experience integration. D. Repetitive drills with minimal feedback. 31. Which action is a violation of informed consent principles? A. Explaining risks and alternatives before procedures. B. Using simplified language to aid understanding. C. Performing a procedure without consent in non-emergency. D. Answering questions before obtaining consent. 32. The primary purpose of OSHA regulations in clinical settings is to A. Promote cost-saving initiatives. B. Improve electronic record keeping. C. Ensure workplace safety and health standards. D. Protect insurance providers. 33. Adult learners in healthcare benefit most from A. Highly theoretical lectures. B. Repetitive memorization. C. Learning strategies that respect their experiences. D. Authority-driven instruction. 34. A medical assistant shares lab results with another patient by mistake. What type of violation occurred? A. Clinical error. B. HIPAA breach. C. Curriculum flaw. D. Fraudulent billing. 35. Which form of evaluation is best for assessing teaching effectiveness? A. Peer gossip. B. Patient outcomes only. C. Learner feedback and performance data. D. Institutional profit margins. 36. In instructional design, backward design begins with A. Identifying resources. B. Choosing technology. C. Setting learning objectives first. D. Creating quizzes before topics. 37. Which action is not acceptable under the AMA Code of Ethics? A. Reporting impaired colleagues. B. Accepting gifts for referrals. C. Maintaining confidentiality. D. Providing equitable care. 38. The principle of beneficence refers to A. Doing no harm. B. Doing good for the patient. C. Doing as instructed by a supervisor. D. Documenting promptly. 39. A learner-centered approach in clinical instruction emphasizes A. Instructor control. B. Learner autonomy and engagement. C. Strict adherence to tests. D. Uniform content delivery. 40. Which documentation is required before performing an invasive medical procedure? A. Verbal agreement. B. Signed informed consent. C. Provider certification. D. Appointment confirmation. 41. The most ethical response to witnessing patient abuse by a coworker is A. Ignore and avoid conflict. B. Inform the patient it's normal. C. Immediately report through proper channels. D. Discuss it during a casual team meeting. 42. Which is a measurable learning outcome in medical assistant training? A. Learners will understand patient needs. B. Learners will appreciate the curriculum. C. Learners will perform accurate blood draws. D. Learners will know how to act. 43. A key component of culturally competent care is A. Treating everyone the same. B. Using one language only. C. Tailoring care to patients' backgrounds. D. Prioritizing financial status. 44. What is the first step in addressing a suspected HIPAA violation? A. Confront the patient. B. Notify legal counsel immediately. C. Report to the compliance officer or supervisor. D. Delete the medical records involved. 45. When mentoring, which behavior best supports professional growth? A. Micromanaging all decisions. B. Criticizing performance in public. C. Offering regular, private coaching and feedback. D. Limiting interaction to tasks only. 46. One goal of curriculum development in allied health education is to A. Follow only federal laws. B. Minimize skill-based training. C. Equip learners with measurable competencies. D. Avoid learner evaluations. 47. Medical assistants who knowingly chart false information may be charged with A. Tort. B. Defamation. C. Fraud. D. Slander. 48. An appropriate method to foster ethical decision-making in students is A. Ignoring ethical issues. B. Introducing real-world dilemmas. C. Avoiding controversial topics. D. Rewarding correct guesses. 49. The term respondeat superior refers to A. A patient's right to refuse treatment. B. An employer's liability for employee actions. C. Mandatory informed consent. D. Employee right to benefits. 50. When working with adult learners, instructors should A. Dictate every task. B. Allow them to reflect on real-life experiences. C. Provide minimal feedback. D. Avoid active participation. 51. Which teaching technique best supports self-directed learning in adult learners? A. Assigning weekly pop quizzes. B. Mandating silent reading sessions. C. Providing optional research-based projects. D. Using only lecture-based content. 52. Which of the following best defines malpractice in medical assisting? A. An intentional breach of confidentiality. B. Failure to provide reasonable standard of care. C. Refusal to assist in a non-emergency. D. Lack of bedside manner. 53. A mentoring strategy that promotes long-term retention is A. Memorization drills. B. Closed book testing. C. Case-based reflective discussion. D. Skill repetition without context. 54. What is a key element of maintaining regulatory compliance in patient billing? A. Estimating service charges without documentation. B. Including undocumented procedures. C. Accurate coding and documented services. D. Using outdated insurance forms. 55. The principle of fidelity in medical ethics requires professionals to A. Always question authority. B. Avoid admitting mistakes. C. Be loyal and keep promises. D. Limit feedback from patients. 56. What should an instructor prioritize when evaluating an adult learner's competency? A. Learner's popularity. B. Time spent in training. C. Demonstrated skill and critical thinking. D. Feedback from friends. 57. A patient refuses treatment. Legally and ethically, the medical assistant should A. Ignore the request. B. Report and document the refusal. C. Persuade the patient to change their mind. D. Continue the procedure. 58. When designing health education materials for adult patients, a best practice is to A. Use complex medical terminology. B. Prioritize visual aids and plain language. C. Focus only on medication schedules. D. Include physician resumes. 59. A professional boundary violation in mentoring may include A. Providing career guidance. B. Inviting ments to social events outside work. C. Reviewing clinical documentation together. D. Discussing learning styles. 60. What is the best approach when evaluating clinical instruction techniques? A. Peer opinion surveys. B. Instructor intuition. C. Pre- and post-training skill performance data. D. Institutional tradition. 61. What law protects employees who report unethical or illegal activities? A. HIPAA. B. Whistleblower Protection Act. C. High-Tech Act. D. Fair Labor Standards Act. 62. Which educational approach helps build problem-solving skills in adult learners? A. Passive listening to lectures. B. Role-playing real clinical scenarios. C. Mandatory textbook readings. D. Multiple-choice worksheets only. 63. Which situation best illustrates a conflict of interest? A. A medical assistant working part-time at another clinic. B. An instructor promoting a textbook they helped publish. C. A student asking for tutoring help. D. A mentor reviewing mentees' evaluations. 64. Which of the following is an effective method for assessing critical thinking in adult learners? A. Yes/no quizzes. B. Open book tests. C. Case study analysis. D. Memorization lists. 65. When handling a medical error, ethical practice requires A. Ignoring it if no harm occurred. B. Blaming a colleague. C. Reporting and disclosing appropriately. D. Covering up to avoid lawsuit. 66. A mentee asks about tasks outside their legal scope. The mentor should A. Allow it for learning purposes. B. Assign the task secretly. C. Clarify legal boundaries and redirect. D. Ignore the question. 67. A formative evaluation during clinical instruction is used to A. Determine final grade. B. Guide immediate feedback and improvements. C. Measure patient satisfaction. D. Certify staff promotion. 68. What federal law requires providers to protect electronic health records? A. FERPA. B. OSHA. C. HITECH Act. D. ADA. 69. The best example of a measurable instructional objective is A. Learner will understand infections. B. Learner will list 3 types of PPE. C. Learner will value patient safety. D. Learner will be more aware of procedures. 70. To meet ADA compliance, a clinic must A. Provide free services. B. Offer materials in accessible formats. C. Ignore requests from patients. D. Enforce standard fonts only. 71. Mentoring is most effective when A. Done sporadically. B. Built on mutual trust and communication. C. Focused only on policies. D. Reserved for licensed professionals only. 72. A clinical instructor should adjust curriculum when A. Learners complain. B. Evaluation results show poor outcomes. C. Supervisors suggest more tests. D. Materials are colorful. 73. A medical assistant performing duties without certification may face A. Promotion. B. Legal penalties. C. Patient gratitude. D. Extra responsibilities. 74. Which adult learning theory emphasizes hands-on experiences? A. Cognitive load theory. B. Constructivism. C. Behaviorism. D. Connectivism. 75. What is the most ethical action if a learner reports harassment? A. Dismiss the concern if there's no proof. B. Conduct a group discussion. C. Report through institutional channels and support the learner. D. Postpone action until training ends. 76. In evaluating training effectiveness, Level 3 of Kirkpatrick's model assesses A. Learner satisfaction. B. Knowledge gain. C. Behavior change on the job. D. Organizational ROI. 77. A professional email to a learner should avoid A. A warm greeting. B. Clear, respectful tone. C. Sharing private opinions about others. D. Summary of key points. 78. When documenting an informed refusal, include A. Patient's age and allergies only. B. Verbal agreement. C. Date, time, risks explained, and patient's signature. D. Only the provider's note. 79. Adult learners typically prefer A. Instructor-led, fact-based lectures. B. Theory-heavy content. C. Relevance to real-life goals and autonomy. D. Group memorization tasks. 80. Which is an example of nonverbal therapeutic communication? A. Nodding and maintaining eye contact. B. Handing over a document silently. C. Writing a prescription. D. Taking a phone call. 81. Which law prevents discrimination against individuals with disabilities in healthcare? A. EMTALA. B. ADA. C. HIPAA. D. FMLA. 82. A medical assistant alters chart entries. This is an example of A. Quality improvement. B. Fraudulent behavior. C. Diagnostic error. D. Documentation efficiency. 83. A mentoring session should begin with A. Informal gossip. B. Clarification of goals and expectations. C. Instructional penalties. D. Patient complaints. 84. Evaluation rubrics in clinical instruction help ensure A. Random scoring. B. Subjective judgments. C. Consistent, measurable feedback. D. Instructor convenience. 85. The most effective strategy for managing resistance in adult learners is A. Imposing strict rules. B. Ignoring it. C. Acknowledging concerns and encouraging dialogue. D. Dismissing participants. 86. Which situation may lead to abandonment charges? A. A patient leaves AMA. B. A provider discontinues care without notice. C. A patient transfers care voluntarily. D. A provider offers a referral. 87. A mentor's responsibility includes A. Solving all the mentee's problems. B. Doing the mentee's work. C. Guiding learning and offering developmental feedback. D. Promoting ments to supervisors. 88. A signed release of information form should include A. Diagnosis and test results. B. Name of recipient, date range, and purpose. C. Social Security number only. D. Generic authorization. 89. An example of unprofessional conduct is A. Asking a peer for help. B. Arriving early for shift. C. Sharing a patient's condition at lunch. D. Documenting vitals on time. 90. The term sentinel event refers to A. A billing discrepancy. B. A predictable patient outcome. C. An unexpected occurrence causing serious harm. D. A scheduling error. 91. The primary benefit of self-assessment tools in adult education is to A. Replace instructor evaluations. B. Help learners reflect on performance. C. Eliminate the need for rubrics. D. Test memorization. 92. Which is a HIPAA-compliant method of disposing patient information? A. Placing it in a recycling bin. B. Handing it to a third party. C. Shredding documents securely. D. Deleting files without backup. 93. The SOAP note format is primarily used for A. Scheduling appointments. B. Standardizing patient progress documentation. C. Creating budgets. D. Labeling supplies. 94. When mentoring a struggling learner, the best strategy is A. Punish errors. B. Offer guidance and supportive accountability. C. Ignore concerns. D. Reassign to another department. 95. According to OSHA, safety data sheets SDS are required to A. Summarize patient data. B. Identify chemical hazards. C. Record HIPAA violations. D. Track student grades. 96. Which principle is most aligned with ethical communication? A. Clarity and transparency. B. Withholding complex terms. C. Generalized statements. D. Avoiding confrontation. 97. Adult learners differ from younger students because they A. Learn better in large lecture halls. B. Lack motivation. C. Bring real-world experience and expectations. D. Dislike feedback. 98. Which best supports a safe clinical learning environment? A. Ignoring learner concerns. B. Immediate corrective action and supervision. C. Isolated training without oversight. D. Delaying feedback. 99. Which action upholds patient confidentiality? A. Discussing details at lunch. B. Faxing records without cover sheet. C. Only sharing with authorized personnel. D. Posting updates on social media. 100. Which law mandates equal access to emergency medical treatment? A. FMLA. B. EMTLA. C. ADA. D. HIPAA. RMA Medical Laws, Ethics, and General Knowledge. The RMA Medical Laws, Ethics, and General Knowledge Test is a comprehensive assessment designed to evaluate a medical assistant's understanding of legal responsibilities, ethical conduct, and foundational knowledge essential to clinical practice. It covers topics such as patient rights, confidentiality, consent, professional boundaries, and the legal scope of practice. Test takers must demonstrate knowledge of regulatory compliance, e.g., HIPAA, OSHA, ethical decision-making, and effective communication within healthcare settings. The exam also includes questions on mentoring, evaluation methods, curriculum development, and adult learning principles to ensure medical assistants can function competently in both clinical and educational roles within a medical environment. Here are the top 5 beneficial uses of the sample exam. 1. Ensures legal and ethical competence. The test validates a medical assistant's understanding of healthcare laws, patient confidentiality, informed consent, and ethical behavior. helping prevent legal violations and uphold professional standards. 2. Promotes safe clinical practice. By reinforcing knowledge of regulatory compliance, e.g., HIPAA, OSHA, the test supports safe, legally sound clinical environments and reduces risks for both patients and providers. 3. Prepares for professional responsibilities. The exam helps candidates apply ethical principles in real-world scenarios, enhancing communication, accountability, and integrity in healthcare settings. 4. Supports career advancement. Passing the test demonstrates readiness for increased responsibility, opening doors to leadership, mentoring, and instructional roles within medical practices. 5. Guides educational program improvement. Results from the test can help educators assess training effectiveness and identify areas for curriculum enhancement in ethics and general medical knowledge.